Hello, welcome to Core Renewal. My name is Martha Flieger, and Core Renewal is the name of my private practice. I am a certified and licensed Rolfer, Laban movement analyst, and massage therapist. I graduated from the Rolf Institute of Structural Integration in Boulder, Colorado, from the Laban Institute of Movement Studies in New York City, and from the Summer School of Massage in California. When I decided to get Rolfed, it was because I had an overuse injury for the first time in my modern dance career, and nothing else was really helping my ankle. I'd heard the process was going to be really intense and painful, and so I approached my Rolfer's door with some trepidation. Well, much to my surprise, it was a really enjoyable process, and I was so excited about it, I immediately applied to the Rolf Institute to become a Rolfer myself. So what I want to show you in this video are some of the things that you might experience in a Rolfing session and some of the movement cues that can help you coordinate healthy principles into your everyday activities and utilize the new potentials that Rolfing has liberated in your body. This client gets stuck at about 110 degrees when asked to raise his arms overhead. Here we're mobilizing the collarbone to relieve pressure on the large nerve tracts, muscles, lung tissue, and blood vessels which run underneath it. Here I'm using his hand as a lever to evoke length and resilience in an incredibly tight muscle. The two long bones in the forearm need to be able to spiral around one another. Cross-fiber friction and gliding strokes are helping to release adhesions between his shoulder blade and spine. Now we're calling for glide between his shoulder blade and the rib cage. Next, we're grounding the shoulder girdle on the back, using a long stroke to connect it into the lower spine and pelvis. Here I'm lifting the lateral edge of the latissimus dorsi and its fascial sheath to ensure it's free from the layers below. Sometimes it feels really satisfying to have deep pressure directly into dense and fibrous tissue. The key is to move slowly and to let you decide the appropriate depth of pressure. Side lying is a great position for three-dimensional sculpting of the body relative to a vertical midplane. This client has a healthy shoulder joint, allowing us to use his arm overhead for tractioning and lengthening the entire side of his trunk. we would need to modify this approach for an injured, painful, or limited joint. We're finishing by connecting through to the head and neck. Allowing the blades to release down and glide on the rib cage. Bones in the forearms spiraling the palms to face one another. The two long bones in the lower leg need spring and the ability to rotate into and away from one another. Therefore, the membrane which connects them needs to be both strong and resilient. Bending the knee to ease surface tension and using the foot as a lever allows access to this deepest layer without requiring undue force. Here we're coaxing balanced hinging of the knee and ankle. The thigh and lower leg also need to be able to counter-rotate. This technique both tests and gently treats the ligaments inside the knee joint. Here the client is stretching his own inner thigh tissues by reaching back with his hips. This technique calls for the hip sockets and fascial envelopes which encase the 3 hamstring muscles to be more adaptive to parallel tracking and functionally independent of its neighbors. Full range of motion is necessary to maintain a healthy hip socket. Here we're crossing the midline, externally rotating to barrier, extending and stretching. Opening away from midline, internally rotating, again extending and stretching. Notice the power of activating the pelvis and utilizing the hip sockets as a hinge to improve spinal alignment and posture. Organs also require mobility for health. I'm gliding the rib cage to both test and treat motion restrictions of the liver along a diagonal arc. As living bone is flexible, we can begin to influence the heart via its connective tissue attachments under the breastbone. I'm following the breath, culminating in an exaggeration of the exhale and a quick release on the next inhale. Now we're gently coaxing the descending colon medially and then laterally, medially, then laterally. Here, the client will hip hike and hip stretch to help ease lower back and rib restrictions on his kidneys. Position your pillow so that your face can softly roll down the incline for a greater neck release. Imagine where the ribs meet the breastbone is pliable, much like a spongy accordion that can squish and expand. As you slowly roll forward and back, yield and surrender your weight into the floor or your mattress. Allow the organs inside your chest and belly to fully relax, glide, and conform to these motions. So I've demonstrated here a few techniques that can be used in a Rolfing session, but there are many, many choices that can be made and modifications for every clinical need and personal preference. It's important to know, though, that Rolfing isn't a technique, it's a system of bodywork rooted in principles of full body organization, full body coordination within the gravitational field. So whether we're creating an individual session, a personalized series, or offering the 10 series, the comprehensive full body 10-session reorganization process that Ida Rolf left, rooted in her many, many years of research and study and practice. We're going to draw on these. So whether you're seeking relief from pain and tension, improved posture, greater flexibility and coordination, mastery over your body, accelerated improvement in a mind-body technique such as yoga or Pilates, dance, or you want to just feel more at home in your body, more comfortable and at ease, to have a greater freedom to express yourself on that physical plane. Rolfing can provide a really profound vehicle for that transformation. It will offer experiences that really grow your self-awareness and self-knowledge. So I hope this video has given you a little bit more information to decide if this method might be right for you in your healing journey. So thank you very much. Bye-bye.